Welcome back to my channel, and in this video we are going to take forward our shoulder complex discussion into the third joint, that is the scapulothoracic joint. The scapulothoracic joint is quite different from other joints because it is not a true anatomical joint but a functional. What is the difference between anatomical and functional joints? And do you know what are the movements that are possible in the scapulothoracic joint and how is it possible? If you want to know the answers, stay tuned to this video, and here we are going to explore scapulothoracic joint in the most easiest and simplified manner. We are going to discuss about the scapulothoracic joint, and as I told you, the scapulothoracic joint is quite different from other joints because it is a functional joint rather than an anatomical joint. What do you mean by anatomical joint? For example, we saw the acromioclavicular joint, the acromion process and the clavicle. These ones are not simply sitting over here, but instead it is being joined by some fibrous capsule. Okay, there is synovial lining, there are associated structures like meniscoids, etc., and there are ligaments which joins this one like this. Okay, this sort of structures, anatomical structures such as a fibrous sheath or a fibrocartilaginous sheath or a synovial membrane are not seen in functional joints. So a functional joint is a joint in which the joint is not true anatomical in nature. The bony components will not be joined together by the fibrous connective tissue or fibrocartilaginous structures or associated structures. Instead, there will be just two bones sitting over like this. Okay, such joints are known as functional joint, and our scapulothoracic joint is a true functional joint rather than an anatomical one. And before going forward, let me remind you, if you haven't subscribed to the channel, kindly subscribe to the channel. Right, so this is a functional joint and not a true anatomical joint. But what is the articulation of scapulothoracic joint? It is the articulation between scapula on the thorax. So it is an articulation between scapula on thorax. So scapulothoracic joint is an articulation of scapula on the thorax. It is not a true anatomical joint, but it is a functional joint. Now if it is a functional joint, that means you have your ribs over here like this and your scapula is simply resting on it. There are no ligamentous connection, there are no fibrous connection linking the scapula with the ligament, the thorax, with the ribs. So how is it going to sit over there? Can it simply sit in the vacuum? No. What is happening is, of course, the muscles has a great role. At the same time, the structural integrity between the scapulothoracic joint and acromioclavicular and sternoclavicular joint is providing the structural integrity and mobility to this joint. Is it a tough thing to understand? Let us just have a look over here. For example, this is the scapula, and here we have ribs. So this will be the scapulothoracic joint. But that joint is linked to the acromioclavicular joint through the clavicle, right? It is linked to the sternum like this through the sternoclavicular joint. So these three joints are in fact linked together. The scapulothoracic joint is continuous as the acromioclavicular and the sternoclavicular joint. That means these three joints are structurally linked to each other. Okay, that means the structural integrity or the motions in the scapulothoracic joint are of course possible due to the movements that are taking place in the acromioclavicular and sternoclavicular joint. If you look closely, we can see here we have the thorax on one end, we have the sternum on the other end, then we have the continuity of scapula, acromion and the clavicle. Both ends, proximal or distal end, both ends are fixed. Okay, both ends are there. That means this becomes a true closed chain. So this joint, scapulothoracic joint, behaves like a true closed joint with the help of acromioclavicular and sternoclavicular. And what is the result of that? The result is that the movements that are going to take place in the acromioclavicular joint and sternoclavicular joint will therefore be possible or will produce movements in the scapulothoracic joint. In fact, the scapulothoracic joint motions are possible due to the movements that are possible in the acromioclavicular and sternoclavicular joint. How far the acromioclavicular, sternoclavicular contribute, we will see that later. So you need to get into your mind before we move on to the motion. The acromioclavicular motions and sternoclavicular motions has an impact on the scapulothoracic joint. It can occur with the help of acromioclavicular or sternoclavicular or both of the joint motions. Usually the scapulothoracic joint motion involves both of the joints, acromioclavicular and sternoclavicular, not one alone. It can occur with the one alone, but it is mostly occurring with the two joints. Now here we have a concept known as the resting position of scapula, which you need to remember. So this is the resting position of scapula. That means the scapula will be normally in this position. From that position, scapula is going to move forward. We studied in the previous video, if this is the frontal plane or coronal plane, we see that the scapula is slightly oriented away from it through a degree of 30 to 45 degree. So the resting position of scapula is, it is oriented 30 to 40 degree from the coronal or frontal plane. Alright? Yes, that is first thing. It is 5 centimeter from the midline of the body. 5 centimeter from the midline of the body. That you can remember. For example, if here we have the midline of the body and vertebral column, this distance would be approximately about 5 centimeter. So it will be away from the vertebral column or midline of the body. Of course, vertebral column is considered the midline of the body by about 5 centimeter. And it stands between 2nd to 7th rib. So it expands or it continues between 2nd to 7th rib. The third point here is 2nd to 7th rib. Am I right? And next one that we need to look. For example, if you look in this direction, that is from laterally, we see that the scapula is not straight, but it is in fact slightly oriented. So if this is the vertical line, scapula won't be straight like this, but it will be slightly oriented like this. It will be slightly oriented like this, about 10 to 20 degree from the vertical. So it is oriented about 10 to 20 degree from the vertical. 10 to 20 degree from the vertical in lateral view. Okay. Whereas if you are looking from the posterior side, if it is looking from the posterior side, the scapula is slightly upwardly rotated by about 5 to 10 degrees. That means you can see that this is the longitudinal axis of this bone, but the scapula is in fact resting in this position. So this angle would be 5 to 10 degree. Am I right? So that angle would be 5 to 10 degree. We summarize the motions of the resting position of scapula. We see that the scapula is located from the midline of the body by 5 centimeter, ribs 2nd to 7th rib, 2nd to 7th rib. So this will be the position of a scapula. It is upwardly oriented by 5 to 10 degree. If you are looking from the coronal plane, it is 30 to 40 degree from the coronal plane, or it is usually like in a protracted position. And about, what is that? The next one is laterally rotated. From the lateral view, if you are looking this one, the scapula is slightly anteriorly tilted by 10 to 20 degree. Anterior tilt about 20 degree. That means, in essence, the scapula is not simply as a straight line. It is in fact slightly anterior tilted 10 to 20 degree. Okay, it is away from the midline. If this is the midline, if this is the midline of the body, this one is not close to the midline. It is 5 centimeters from the midline of the body. This one is not sitting like this, but it is slightly upwardly rotated, and we have this angle over here. That angle would be what? Yes, that angle would be 10 to 20 degree from the vertical or from the posterior view. So that is the resting position of scapula. Sometimes they might ask you, what is the resting position of scapula? Okay, so this resting position of scapula is very important, not just for examination point of view, but for professional also, because the imbalance in the scapular muscles can be found out identifying the resting position of scapula. But you should remember that these are not the standard value. There can be slight variation between the individuals. So it is always not better to examine the scapulas in both sides and finally arriving at a conclusion rather than completely depending on this one. You can depend on this one, at the same time measure the scapula, look the symmetry of the scapula in both sides, and then arrive at a conclusion. Clear? Now let us move on straightforward into the motions of the scapula. Remember, while studying the motions, the scapulothoracic joint motions are actually the motions that are possible in the acromioclavicular and sternoclavicular. Contributions are there. Okay. Now what are the motions of scapulothoracic joint? You can note down the scapulothoracic joint motions are in fact the same motions that are happening in the acromioclavicular joint. So what are the acromioclavicular joint motions? The acromioclavicular joint motions we studied in previous session, that is the internal and external rotation, right? Anterior and posterior tilt, right? Anterior and posterior tilt, right? And the last one was upward and downward rotation. Upward and downward rotation. So these are the same movements that are going to happen in the scapulothoracic joint. But it is not same as the movement that is happening here. Of course, there is a difference in contribution between acromioclavicular and sternoclavicular joint. We will examine that closely. So these are the same movements that are going to happen in this joint. What are that? Internal and external rotation, anterior and posterior tilt. So if you are someone who are studying for the examination, you can just correlate this and study. The movements in acromioclavicular and scapulothoracic are the same. Upward and downward rotation. Upward and downward rotation. And if we look closely, we see that in this three movement, the upward and downward rotation is the most visible and most predominant movement in this scapulothoracic joint. So we call this movement as the primary movement, and we call this movements as the secondary movement. So in the rotatory movements that are possible in the scapulothoracic joint, we have three movements. In that, one is the primary movement, which is upward and downward rotation. Whereas we have two secondary movements, which includes internal rotation, external rotation, anterior tilt and posterior tilt. Clear? Yes, that's so simple. Now let us examine what are the movements. Clear? Okay. So if anybody asks you what is the primary movement that is going to happen in the scapulothoracic joint, it is the upward and downward rotation. Yes, upward and downward rotation in the scapulothoracic joint is the most primary movement that is going to happen. Upward and downward rotation. How is it estimated, or what is the reference point? Of course, glenoid fossa is the reference point. So upward rotation just means this one. The glenoid fossa moves upward. It's simple. The same thing that we studied in the acromioclavicular joint. So the upward rotation means the glenoid fossa of the scapula moves upward, or the inferior angle moves away from the vertebral column, midline of the body. So upward rotation can be defined as the glenoid fossa moving upward, or the inferior angle of the scapula moving laterally or away from the vertebral column. Right? Am I right? So now we are going to look forward how this movement is going to happen. So what is the reference point? The reference point is Don't forget that is the glenoid fossa and or the inferior angle. Any of that you can take up the reference point. And the normal range of motion that is possible is about 50 to 60 degree. And we studied what is the reference point, what is the movement going to take place, how the movement is going to take place. But I told you that these movements are actually the movements that are taking place or contributed by the acromioclavicular and sternoclavicular joints. So the movement, upward rotation of the scapula and downward rotation involves movement of the sternoclavicular joint and the acromioclavicular joint. Let us see which are the movements that are possible in the sternoclavicular and acromioclavicular. For that, we wrote down already the acromioclavicular joint motions. Let me write down what is a sternoclavicular motion. Protraction and retraction, am I right? Internal, anterior and posterior rotation, right? And one more movement, elevation and depression. Elevation and depression. Now tell me, you just which are the movements that is going to happen? If you're going to find out this, definitely you won't forget this one. Okay, so this is how the orientation is. Now, which is the movement that we need? We need the upward rotation in the glenoid fossa or the scapula. This is the upward rotation. Now let us look what are the movements that are going to take place in the sternoclavicular joint. What are the movements? Protraction and retraction. What is sternoclavicular protraction and retraction? This is the movement. Protraction, retraction. Am I right? This is the movement. Do we need that movement to move upward? No. So we don't need that movement to move upward, right? Yes. The second movement, elevation and depression. Look, do we need that? Of course. We need elevation and depression. Without clavicular elevation and depression, this movement of upward movement is not going to take place. So we need elevation and depression. So the second movement would be elevation and depression. Very good, right? You picked the answer. So the movement would be elevation and depression. What will be the third movement? Anterior and posterior rotation. Is that needed? Of course, you should remember, if you look at like this, you will think that it's not required. But the scapulothoracic joint, sternoclavicular, it is also linked to the acromioclavicular. Without this slight opening of the posterior rotation of the clavicle, this movement is not going to take place in a complete form. So, you might need to remember that three movements in the sternoclavicular joint, two movements are going to take place in the scapulothoracic joint movement, which are the elevation, depression, anterior and posterior rotation. So we picked out the answer. So instead of by hearting this, remember sternoclavicular joint is having three movements, and in that two movements are only happening here. Which are the two movements? Just think in your mind, if you are writing the examination or clinically examining a patient, anterior and posterior rotation. Sorry, the protraction and retraction, is it going to provide upward and downward rotation? No, it has not. So you can remember, just cross-cut that and just go on to this one. What about the acromioclavicular joint? Which movement will be happening in the acromioclavicular joint? If you're not going to give the straight correct answer for this, you'll get a scold. It is simple, the same movement. What is the same movement? Upward and downward rotation. So upward and downward rotation will be the same movement that is happening in the acromioclavicular joint. So a scapulothoracic joint, upward and downward rotation means it involves scapulothoracic joint, sternoclavicular joint, elevation and depression, anterior and posterior rotation, and the same movement in the acromioclavicular joint. So it became much more easy. You can straight away write down that acromioclavicular joint, it will be the same movement. Okay. It is the same movement. If it is the upward rotation of the scapula, it will be upward rotation in the acromioclavicular joint, and it will be elevation in the sternoclavicular joint. If it is the downward rotation of the scapula, it will be definitely acromioclavicular joint downward rotation and depression in the sternoclavicular joint, and of course anterior and posterior rotation respectively. Is it clear? That's only the thing that you need to remember in this one. And there is one more thing, that is the upward and downward rotation of the scapula is contributing to the upward and downward rotation of the scapula. The sternoclavicular joint, anterior and posterior rotation is contributing 2/3 of the range of motion. That means the sternoclavicular joint, we have anterior and posterior rotation. This rotation, if it takes place, it can contribute about 2/3 to the scapulothoracic joint. But sternoclavicular joint has another movement which we are interested, that is elevation and depression. That it can contribute only 1/3 of that motion. Only if you need to remember that point, this is sufficient enough. This point is like the sternoclavicular joint, we have two motions, elevation, depression, upward and downward rotation. Upward and downward rotation is the predominant movement that is going to help in the scapulothoracic joint movement by contributing 2/3 of its range of motion. Whereas sternoclavicular joint, elevation and depression only contribute 1/3 of the range of motion to the scapulothoracic joint. Clear? Now the next motion in the scapulothoracic joint is the anterior and posterior tilting movement. Anterior and posterior tilting movement and internal and external rotation movement. It is very simple to understand as it is only a secondary movement. Anterior and posterior tilting movement. Okay? Anterior and posterior tilting movement. Definitely, this movement is not easy to observe. It is very difficult to understand clinically or examine. And this movement involves, what is anterior tilt? Anterior tilt is the same movement in the acromioclavicular joint. Acromioclavicular joint anterior tilt means acromion is coming forward. Acromion is coming forward and the inferior angle is moving backward. So the movement happens is acromion comes forward and the inferior angle moves posteriorly. Okay, so in anterior and posterior tilt in the scapulothoracic joint, there is slight anterior movement of the acromion and inferior movement of this one. But it is not completely as taking place in the which joint? Acromioclavicular joint motion. That is why it is not that easy to measure. So in anterior and posterior tilting, what will be the motions that is going to take place? In sternoclavicular joint and the acromioclavicular joint. Scapulothoracic, anterior and posterior tilt. In acromioclavicular joint, it will be the same movement. Always remember, anterior and posterior tilt. Now tell me, which movement in the sternoclavicular joint can take place here? Is it elevation, depression happening in anterior tilt? Is it protraction, retraction? Is it anterior rotation, posterior rotation? You know the answer. That is the elevation and depression at the sternoclavicular joint. You might have a confusion whether it is a protraction or retraction or elevation and depression. It is anterior tilt. It is anterior tilt. Only the scapula is tilting this one. Scapula is not getting rotated this way. If it is getting rotated only, we are going to have the protraction. So we will understand by the next movement. So this is the elevation and depression. So what is that movement? Elevation and depression. Here only one movement is contributing to the anterior and posterior tilt. So anterior and posterior tilt is a less observable movement, and in this movement the acromion process of the scapula moves anteriorly and inferior angle moves posteriorly, and in the acromioclavicular joint the motion that is taking place is the anterior and posterior tilt, whereas in the sternoclavicular joint the motion that is taking place is the elevation and depression. It's just that only. Whereas the next movement that we are going to think is the internal rotation and external rotation. What happens in internal rotation and external rotation in the acromioclavicular joint? In internal and external rotation, we studied that the glenoid fossa is moving anteromedially and posterolaterally. Just remember that we studied in the previous session, that is it is moving anteromedially and posteromedially. So in internal and external rotation of the scapulothoracic joint, what is going to happen? The glenoid fossa is moving anteromedially and posterolaterally. The glenoid fossa is moving anteromedially and posterolaterally. So what will be the movement that is happening in the sternoclavicular joint and acromioclavicular joint? Acromioclavicular joint always the same movement. So elevation and internal rotation and external rotation in the scapulothoracic joint will be contributing through the internal and external rotation in the acromioclavicular joint, and at the same time in sternoclavicular joint what movement will happen? Anteromedial movement of the glenoid fossa. This is the anteromedial movement. This is not the anteromedial movement. Anteromedial movement is this one. What is this movement in the sternoclavicular joint? Protraction and retraction. Clear? So that is so simple. That is the protraction and retraction. So anterior and posterior, internal and external rotation in the scapulothoracic joint is a very less movement, is a very less observable movement, and it is taking place with the help of sternoclavicular and acromioclavicular joint movement. Sternoclavicular joint movement is protraction or retraction. Acromioclavicular joint movement is the same one, which is the internal and external rotation. Clear? Now you see that if, for example, this is the spine, if this is the spine, midline of the body, and now this is the internal rotation, glenoid fossa coming anteromedially. If there is an excessive internal rotation, this medial border of the scapula can be prominent, and it might sit like this. You can see it prominent in the shoulder. Such a situation is known as the winging of the scapula, where if there is an excessive internal rotation of the scapulothoracic joint, the medial border may become prominent, and that situation is known as the That situation is known as the winging of the scapula. That is due to the functional imbalance between scapulothoracic muscles. Okay, we'll study winging of the scapula later in the clinical conditions in this chapter. So remember, if there is an increase in the medial border or the increase in the internal rotation of the scapulothoracic joint, it can produce a condition known as winging of the scapula. Am I right? Yes. So we studied which are the three rotatory motions in the scapulothoracic joint. What are that? Upward and downward rotation. What is that? Upward and downward rotation. Glenoid fossa moving upward and inferior angle moving laterally. Okay, downward rotation exactly opposite. Anterior and posterior tilting. Acromion moving anteriorly, this moving posteriorly, but it is not that much observable as seen in the acromioclavicular. And anterior and internal and external rotation. Glenoid fossa moving anteromedially and posterolaterally. There is a contribution through acromioclavicular and sternoclavicular joint. That is a difference in scapulothoracic joint. It's not purely happening in the scapulothoracic, but it is actually happening due to movement in both the other joints. Now, what about the translatory movements that is going to happen in this joint? The translatory movements in this joint is very important. Elevation and depression. What is that? Elevation and depression, and protraction and retraction. Let us look into that. Elevation and depression and protraction and depression. For example, if we have the scapula here in the thorax like this, okay. Now, if the scapula is moving upwards like this, simply it is moving upwards. This movement is known as elevation. And this is known as the depression if it is moving downwards. The translatory movement of the scapula, where scapula just moves upward like this, is known as elevation, and it is known as the depression. Of course, this is important in mobilizations. Okay. Now, this is elevation and this is depression. So, elevation and depression of the scapula is the scapula moves superiorly, translates superiorly. Remember, this is translatory motion. That means it's not rotatory, just pure translatory movement. So it is a translatory movement upwards. This is a translatory movement downwards. So elevation means scapula moves upward. Depression means scapula moves downward. This is inevitable in our shrugging movement. When you are shrugging the shoulder like this, shrugging movements, of course the elevation and depression of the scapula is been done. Now we need to remember one thing. Our vertebral column or thorax is not a straight line like this, but it is like this. Of course, it is having a curve. Each rib is having some curves. So, it won't be pure translatory motion. There will be slight anterior tilting accompanied. There will be slight anterior tilting accompanied, because we see if it is straight line like this, it can just jump over like this and like this. But if it is a curved one like this, it might need a slight anterior tilt and slight internal rotation movements. Clear? So the anterior tilt is seen in case of elevation and depression. That means elevation and depression is not pure translatory motions. In other joints, you can have elevation and medial lateral translation, anterior posterior translation, superior inferior translation as pure translatory movement. Here that is not possible because of the curved convex shape of the rib cage. Right? Yes. And the last movement is protraction and retraction. What do you mean by protraction and retraction? This protraction and retraction is sometimes referred to as scapular abduction and adduction. What is that? The scapula, when it is sitting like this, if it is moving to this side laterally, if it is moving to medially, one side what we have, in one side we have the vertebral column, midline. Okay, if the scapula is translating outside to the lateral side, it is known as the protraction. If scapula is moving to inside, that is near to the vertebral column, it is known as the retraction. If it is it is also known as abduction, adduction. Abduction means it is very easy to understand. This is abduction away from the midline towards the midline, adduction. But why is it called protraction, retraction? How can it be protraction, retraction? It is just abduction, adduction. No? No, here also the ribs are not straight, but the ribs are like this, curved ones like this. Okay, rib cage has a curve to the lateral side. So if the scapula is sitting over here, if scapula is sitting over here, it can translate and it can translate and it can translate. If it is just a lateral movement, what happens? The scapula will move out of the rib cage. There won't be any contact. Only the medial border may be contact. But scapula has to always follow the contour of the rib cage. Scapula has to always follow the contour of the rib cage. So it will be following this movement. This movement becomes the anteromedial movement. Therefore, we call it as the protraction and retraction. So that is the protraction and retraction of the scapula, which is the second translatory movement. And protraction and retraction of the scapula is the second translating movement, and it accompanies with the sternoclavicular protraction and retraction movement. Okay, that means that is also not a true translatory movement, but it has some other components too. So that is all about the scapulothoracic joint, and scapulothoracic joint is stabilized with the help of lot of muscles around that, and muscles are very important for the stability of the scapulothoracic joint, which we might look forward in the integrated function of the shoulder complex. And next video we are going forward for the glenohumeral joint discussion, straightforward discussion on the glenohumeral joint. And if you like the video, don't forget to click the like button and kindly subscribe to our channel.